Hi, and welcome to Parkinson's Wellness Wednesdays. My name's Alison, and I'm an exercise physiologist who works for Parkinson's New South Wales. Parkinson's New South Wales exercises are not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. Please consult your own health professional team before engaging in any online fitness program. Our weekly Parkinson's Wellness Wednesdays are posed to encourage people living with Parkinson's, their families, carers and friends to challenge each other to be more active and learn why being more active is so important for people living with Parkinson's. Today we're talking about duration, intensity and frequency that people with Parkinson's should exercise. This is a difficult question to answer, as every person with Parkinson's is different. In the early stages of Parkinson's, people can exercise exactly the same as anyone who doesn't have Parkinson's. Later stages of Parkinson's, the duration, the intensity, and the frequency should be tailored to suit each individual's individual symptoms. Firstly, what exactly is duration, intensity, and frequency? Well, duration is the amount of time you exercise in one exercise session. Intensity is the difficulty level, whether it's easy, moderate, or vigorous. And frequency is how often, usually in terms of per week. So 2 times a week, 5 times a week, that type of thing. So what are the recommended levels for adults? And I'm going to aim this mainly at the over 65s, and that's where we're heading for. Okay. If you have any specific symptoms that advise against some activities, of course, take your doctor's advice online. Other than that, to be very general, it's at least 30 minutes of moderate intensity physical activity each day. Now, that could be 150 minutes of moderate intensity exercise or 75 minutes of cardiovascular intense exercise. So you can do a little longer at a moderate level or a little shorter time at a heavier, more intense level. And this can also be broken up into 10 minutes 3 times a day, or 20 minutes twice a day, and gradually add it up over the week. So any combination that will fit with you and your lifestyle. Of course, don't start exercising at that level if you haven't been exercising at all previously. Start small and build up to your levels. Also remember, people with Parkinson's aren't sick. You don't have an illness per se. You have a neurological disorder that exercise greatly improves. Exercise is only second to your medications as the best treatments for Parkinson's. Aim to do some activity, however light. Some is better than none, no matter what your age, weight, health problems, or your abilities are. Examples of activities and exercise that require a moderate effort for most people is walking fast, doing aqua aerobics, ballroom and line dancing, riding a bike on level grounds with an occasional little hill, playing doubles tennis, pushing a lawnmower, canoeing, volleyballing, that type of thing. Strength training is slightly different, and it's another facet of exercise that people with Parkinson's benefit from greatly. And the recommended frequency for strength training is to train the entire body in big muscle groups 2 to 3 times a week on non-consecutive days. So not Monday and Tuesday and then the rest of the week off, Monday, Thursday, that type of thing. Break it up so your body has time to recover in between. When undertaking strength training, you're doing at least 1 to 3 sets. So you're doing, hopefully, what I'm recommending as a general strength way is you do 8 to 12 repetitions or 8 to 12 lifts or movements relating to that muscle group that you're training. So you're going to do, let's say, 10 repetitions 3 times. That's basically what it comes down to. So you start off with 1 set of maybe 8, and 3 months later you might be doing 2 sets of 10, and then finally 3 sets of, say, 12. So somewhere between 1 and 3 and 8 and 12 repetitions per set. Just as a guide, always consult a professional to make sure it's right for you. And examples of muscle strengthening activities include carrying heavy loads such as big bags of groceries, activities like stepping and jumping and things involved in dancing, heavy gardening, digging, shoveling, and exercises that use body weight for resistance, such as push-ups, squats, or sit-ups. Yoga and lifting weights, of course, as a training activity, are all muscle strength related exercise. And to know if you're working at a moderate intensity or a vigorous intensity, the talk test is a great way to know. With moderate intensity, you should be able to maintain a conversation while you're moving. So if you're out walking with a friend, you should be able to talk to them. You might be a little breathless in between words, but no problem continuing. If you hit a big hill and you start becoming very breathless and it's difficult and you do not want to talk to that person anymore, you've definitely gone into the vigorous zones. There's lots of other ways to assess moderate and vigorous, but this is an easy one that just you can take with you anywhere. I like my clients to do some form of activity every day. I like them generally to do 2 to 3 days of cardiovascular aerobic work and 2 to 3 days of strength training, along with other individual small types of exercise, speech therapy exercises or singing for exercising the vocal cords, which is very important for breathing and not choking on food, and fine motor skills exercises such as writing and drawing to keep your handwriting and other things working in a slightly better way. And of course, there's cognitive exercises such as games, Sudoku, crosswords, and puzzles, just to keep that cognitive muscle, i.e. the brain, moving. Today's exercise is for your upper back. Now, if you're in a gym, you can certainly use a weight to do this, and that's probably the easiest way to do it. But at home, there's no reason you can't do it. So you can use, I'll just get a chair, or a table, doesn't matter which, and you lean your body weight onto the chair. Make sure it's stable and can hold you. From that point, anything at home, could be a handbag, could be a brick, it could be a can of baked beans, doesn't matter. You center yourself, pull your elbow up beside you, and lower the weight down. So you're pulling the weight in your hand up and down. Now, as I said, it can be a handbag, it can be a brick, it can be a tin, doesn't matter what. And today I'd just suggest 3 lots, so 3 sets of 10 repetitions. And by the 9th and 10th, you should be struggling to keep lifting it. That's the weight that you're wanting to work with. So that by the 10th one, it's a challenge for you. So you want your back supported, your body, and you're safe and secure, making sure you can't fall or land on anything, and just leaning, supporting your weight so your back's not hurting, on a table, on a chair, on a bench, whatever happens to be handy. That's the best way to do any form of weights. Make sure you're supported, secure, no risk of falling, and yeah, you're completely safe. Please type any questions you have into the comments section. I'm here and I will answer them as soon as possible. If the question you'd like to ask is personal and you prefer not to write in the comments, please send us a message through Messenger or call our info line on 1800 644 189. And thank you for watching. Keep well, and I'll see you next Wednesday.